Hello, everyone, and welcome to ACP's live remote non-CE offering. I'm Kelly Contreras, and I'll be the moderator for today's webinar. This is part of a larger live remote clinical offering calendar that we launched to provide additional remote resources and outreach to our facility partners during this time of disruption in our industry. On behalf of everyone at ACP, I want to extend a sincere thank you to all of our facility partners for providing exceptional care to patients during this very challenging time. We cannot wait to get back to you all live and in person. In the meantime, we're offering virtual facility visits by our clinical program consultants, augmented by this series of live remote clinical offerings. The clinical services team has worked to create a high quality remote experience for you. Today's non-CE topic is cycle walk pens, overview, as well as questions and answers, and will last approximately 45 minutes. I want to begin by covering just a few housekeeping points for our course today. During this non-CE offering, you'll be able to ask questions using the Q&A feature. These will be fielded by myself, the moderator. As time permits, we'll answer any outstanding questions at the end of the presentation. But keep in mind, you can always contact ACP Remote Clinical Support at 1-800-350-1100 option 2, or your assigned clinical program consultant with ACP for any further questions or concerns. We welcome your feedback regarding today's offering and suggestions for what you'd like to see included on the ACP Live Remote Calendar in the coming months. Please take a moment to fill out the survey, which will be provided at the completion of this webinar, so that we may continue to improve these offerings and meet your expectations. I'd now like to introduce Deborah Capella, who will be our presenter today. Debbie is a clinical program consultant out of Maryland and is a physical therapist. Thank you so much for presenting today, Deb. I'm going to turn it over to you.
Thank you. Thank you. Welcome, everybody. Thank you for taking some time to review this device and the options we have with it. Super excited to be able to offer this for you. We now are challenged with being even more creative and thinking of different ways that we can be utilizing our technology to help our patients, potentially with limited resources, possibly bedside treatments or less equipment to be moved from place to place. So the FX2 Cycle Walk Portable is a great option that is easy to add to your repertoire if you're going in and working with your patients. So as we go through the actual unit and kind of showing you how it works, going through some of the setup buttons, I will be demonstrating that. And then we'll also be talking a little bit about what kinds of patients can this be helpful for? What kinds of situations do we see where a patient would benefit from this particular program? We will then, of course, do a demonstration of how you can do this in different manners, talk a little bit about, the practical aspects of keeping your patient, pushing your patient while we're, again, with some limited resources potentially up in the patient's rooms, if that's what's happening, and with some of our really medically complex patients. So finally, at the very end, the plan is also to show you where this particular protocol can be accessed from our traditional eSTIM units that you have on your carts in the gyms. So we'll go through it all. What I'd like to talk is to kind of start with is, this Cycle Walk Portable. This is in many of your facilities. That's why you're on this call. But sometimes people are like, I don't remember hearing about this, or I wasn't here the day that this was talked about, or maybe you're a new employee and you haven't had access to it. So this is really just to kind of discuss it and talk a little bit about the product in general and sort of introduce you to it if you have not had that before. This is what it looks like. So it is a small portable, very similar to a traditional TENS unit that we use for pain management. But this one is clearly specifically for our cycle walk options, which is a neuro reeducation patterned eSTIM. You'll see that it has the same color coding electrode wires where channel A is green, channel B for blue. So very easy crossover from what you're used to seeing on your larger eSTIM devices in the gym. And it comes in a little black case that looks like this. So a lot of people who may not even realize you had this in your gym, I always tell them, it comes in a little black case. This is what it looks like. Take a look around. See if you can find it. If you are on the call today and have it close by, that's awesome. So you can kind of walk along with me as we go through the setup and how this is utilized. So this is what it looks like. This is the case it comes in. Hopefully you'll be able to locate that and use it either today as we go through this or after this is over. I wanted to talk a little bit about, what all the buttons are, how it's set up before I go into the demo. And clearly when I do the demo, we'll repeat a little bit of this. But on the back, you have a battery compartment. So it does take a 9-volt battery. ACP does supply those initially. I think they usually come with an extra one. So if it doesn't power on, obviously the first thing to check, troubleshooting, would be that the battery is in and the battery is still a good battery. So that's on the back. On the top, up here, you're gonna have this green and blue. This is where the electrode wires are inserted. I will show you that again when we get to the live demo. They're not the same wires as we use on our traditional units. So they do come with its own set of lead wires. And again, corresponding channel A being a green, channel B being the blue. The front of the unit obviously has a screen display. We have a button that says A and a button that says B. So these buttons are actually dual purpose. The A button or the B button will allow you to select if you're going to be doing the cycle setup or the walk setup. So if you press the button A, there's going to be a little indicator that indicates that we're on cycle. If I press B, it'll be walk. But they also are a cue to you that, if I want to turn my intensity up, the plus and minus that are right below A will turn up channel A's intensity. And conversely, the buttons that are right below B will adjust the intensity under B. And then clearly we have the power button at the bottom. The plus and minus buttons not only increase or decrease intensity, but those are also used to possibly adjust some of the parameters. And we will go through that in the demonstration as well. So again, pretty straightforward. We're going to probably review all of these buttons again as I go through the demonstration. But I just wanted to kind of give you that overview before we get started. So what kinds of patients? We'll talk a little bit about what kinds of patients we can use this on. We're going to think about general weakness. We generally have 2 protocols, an upper extremity protocol and a lower extremity protocol. So we have the triceps targeted with the upper extremity cycle, and we have the quadriceps targeted as a driver of patterned mobility and reinforcement of patterning for the lower extremity. And that can clearly be done on cycle, assisted cycle, seated exercises. We'll talk a little bit about some of the ideas with walking, weight shifting, pre-gait, all of those items. For cycling, think about those patients that you aren't able to have on their feet for very long possibly, but you still want to work on aerobic conditioning. You're going to put them on something where they're doing a sustained activity. That's a perfect time to add assisted cycling, the patterned cycle pens. We want to encourage them to maybe move a little bit more robustly, maybe practice moving the reciprocal patterns a little faster than they're normally doing it, or with better symmetry. So we're going to be doing the right, left. So we can incorporate that also with our stroke patients. A lot of times that's a really good reminder. My left moves, then my right moves. My left moves, then my right moves. And the ESTIM pattern is just going to be supported when we use the cycle during those activities. Somebody with cognitive impairment, again, we're targeting that nervous system. We're giving it extra input. Very similar to me providing tactile or manually facilitating a patient to move rhythmically. I'm using the ESTIM during the cycling. I want to work on range of motion, osteoarthritic patients, total knee replacement patients. It's a great time to use a cycle for that. Again, we can be supportive of that quadriceps strengthening, which is super important. And maybe it's coordination and somebody who's having some trouble with freezing gait or stopping and starting Parkinson's, stroke patients, a lot of motor control components as well. And those can all be done with the patient seated because possibly they don't have the strength or the endurance to remain standing or to do a lot of ambulation at this point. So we can do this in the assisted cycling mode. The cycle has the walk, and we have walk to run listed here because we can actually increase the cadence to a pretty fast pace if we would like to, especially when we get to our OmniVersa unit. We'll talk a little bit about the cadence and the pace that we can do with that. Again, aerobic conditioning. Let's talk about getting them on their feet and weight shifting and gait initiation. This is a great time to add pens, and again, that extra set of input to the quadriceps muscles in that rhythmic pattern is a really great way to reinforce this neurally. Gait symmetry, very similar to what we talked about before with our stroke patients, possibly even osteoarthritic knee patients who are not used to being active evenly. They're very asymmetric in their gait. We talk a little bit about gait speed, and for your knowledge, as we start talking about some of the things that we're going to be setting up, we have the ability to adjust our pace on the unit prior to starting it. So, where do I want this patient to be? A slow walk is about 42 strides per minute or repetitions per minute. A faster pace, maybe a healthier skilled nursing facility resident is usually at about 60 RPM, and an ambulatory patient who's walking normal community ambulation upwards in 80, 88, almost 90 RPM. So when you're thinking about your patients, we're going to be presetting this before we get started. How do I know where to start? You're going to make your best guess on what you know about your patient. Your patient is very debilitated, has some challenges with cognitive processing. Maybe things take them a little bit of time. I'm going to slow that RPM down so that we can sort of work with it as we're doing our guided activities. So those are some of the ideas. I want to kind of go through now. We're going to switch screens over. Kelly's going to give you a close-up view of the actual unit, and I'm going to kind of review all of these settings and how to find things as we go through the actual unit. So if we can switch over, Kelly. So here it is in a real live picture. You can see I've got the green and black lead wires already plugged in to the appropriate locations. Again, the in, everything's good. So the first thing obviously we're going to do when we get to the unit is we're going to power on. So I'm going to hit that power on button. You can see right away it's going to turn on, and you're going to see that I have my 0 milliamps indicated over channel A and for channel B. And at the very top, in kind of small font, it says walk. So right now it is set up for the walk program. If I would like to switch it to the cycle program, I'm going to press the A button once, and it switches over and now says cycle. If this ever is an issue in the clinic where you press the other button and it is not changing for you, excuse me, sorry. If it gets stuck on one of those, there's the potential when you change batteries or if a battery has gone dead, that the system needs to be reset. It's a really simple thing to do. You're just going to take A and B buttons and press them down and hold them for about 5 seconds, and it'll come up on the screen. It'll say SYS reset, so it's system reset. And then when that is done, it should move back and forth between the cycle and the walk without any problem. It doesn't take any time to fix that situation. Okay, so as I mentioned, right now it's set up for the walk. If I wanted to set this up to start providing current to my patients on channel A, I'm just going to start pressing the up arrow. Okay, so I'm going to press these up arrows until I get my desired outcome. Again, when we get to the lab, I will be demonstrating this, but you may not be able to see me pushing these buttons as clearly because it is such a small unit. I left it alone for a second, and then it comes up and it shows you the time. So this is a 15-minute protocol, as all of our NeuroRead PENS programs are, 15 minutes, and it will indicate where we are on that as we move forward. So it's running right now. I have it set at a relatively low number. because one thing I wanted to point out is that this machine will not let me increase the intensity past about 4 or 5 milliamps if I do not have the electrodes actually connected to a patient. And that's actually a nice thing to know. If you ever are working with a patient and all of a sudden it indicates that channel B is silent, it's most likely, or you want to double check and make sure that one of the electrodes has not lost contact. Sometimes we are working with this patient moving and walking, so that is a possibility, and as a safety mechanism, it will just sort of turn that intensity down if one of the electrodes loses contact. So keep that in mind. You can see I've already gone through 1 minute of my treatment, so it's counting down. And I think you can see in the bottom here, there's the 2 little lock icons, 2 little padlocks. Once I have my intensity set, it is not going to want me to change, inadvertently press a button that will all of a sudden add intensity to the patient. So after being silent for a minute or not even a minute or 2, probably about 15 seconds, it's going to be locked. So I cannot go up any higher on that button. You can kind of see it's giving me a warning there. It will not let me go higher than that until I unlock it. So in order to unlock it, you have to actually press the down button once, and then it will let me go higher. Okay, I'll show you that again. I'm still locked over here. It went to 0 because I don't have it connected to an electrode. So I'll just leave it at 1 for now. So you see it's locked. Again, I can't turn it up until I go down 1. I get that lock icon disappears, and now I can go up in my intensity. And again, I'll leave it alone for a little bit of time. It's going to go back and give me that lock icon again. So it's running. Everything's great, fantastic. I can just go through that right like that, and it's all perfect. So that's sort of a basic setup. I'm going to show you some of the things that we can adjust with this unit, and show you how we're going to do that. If we desire to change maybe the treatment time, maybe we want to change a parameter of the phase duration, which is something that we sometimes do with our PENS treatments. So let me go ahead and we're just going to power that off. And we're going to start over by powering on. Again, I'm on walk. Let's say I want to switch that over to the cycle for this example. I want to see what parameters I can adjust. I'm on cycle, so I need to take the A button, and I'm going to hold that A button down. And if I hold it down for a few seconds, I don't know why it's giving me that. It then pops in and gives me a flashing number here. So that says 15 RPM. So that's the pace that I have it set for. If I want that patient to be stepping more robustly or using that cycle at a higher RPM, maybe I want them to be up at 40 RPM, then I can go ahead and change that just there. Still flashing, I hit that A again. It's going to let me change my phase duration. So those of you who are familiar with our triphasic pens and our programming on our OmniVersa, the default phase duration on that is 70 microseconds. Sorry, I lost it. I didn't do anything quick enough. Let me get this back. This default is 100 microseconds. Okay, so that was done because a lot of these patients we know have a lot of disability and we often do change that phase duration. They went ahead and put this at 100. If I prefer to move that down in increments of 10, I can certainly do that, but the default is 100. I press the A again for the 3rd time, and then it's showing me minutes. So that is a 15-minute treatment. If I do choose for whatever reasons to alter that time, I can go up or down by minutes on that button. Once you leave it alone for a couple of seconds, as you saw before, it's going to default back, and those parameters will have been changed moving forward. Okay. Give it a second to go. There we go. And then I'm ready to go ahead and go up on my intensity, get my desired outcome, and again, it will revert back and show me the timer and that locked icon once I leave it alone for a couple of seconds. Showing me that I got 15 minutes. And then very shortly, you should see those lock icons come back up. So not a whole variety of items to be modified. You can certainly set this up, and if you're getting your desired results, you don't have to worry about changing any of those parameters we just discussed. But if you do want to change those parameters, those do have to be changed prior to starting your PENS treatment. They cannot be changed once you kind of hit go, so to speak. The timer starts automatically, so you don't have to press the start button again. Basically, that's, you know, a kind of super easy way to get things going and not really intimidating at all. There's not too many options that we need to worry about. So that is how we would move through the buttons and set things up. What I'd like to do is kind of check in, make sure, you know, any questions that you have on the operation with this close-up view that I can answer before we move into a demonstration of the cycle walk on me as a lab participant today. So I can kind of give you an idea what it looks like and what are some of the things that can be done when you're using this unit. Kelly?
There are no open questions, Deb.
Okay, fantastic. So what we're going to do now is I'm going to take this off of my stand so we can switch back screens. And I'm going to adjust my camera just a little bit and make sure you can get a good view of me for this lab demonstration. And I'm going to be sitting here. Now, for the purposes of this demonstration, I have put my electrodes on ahead of time. And you'll notice that I have them sort of color-coded. So what we have here is our quadriceps setup. I'm going to be having my negative electrode, which I have made for this lab black purposely so that you can kind of see that really easily. And that is down on my VMO area of my lower extremity so that I can really target that VMO muscle that helps us with terminal knee extension and things, you know, that we need when we're standing, walking, stairs. And then I have my red or positive electrodes that are going to be located further up on my leg. And again, I'm only worried about my quadriceps because with the cycle walk pattern, the pattern is a right, left, right, left, right, left, okay? Versus our triphasic pattern, which most of you are used to, where I would have it set up on both my hamstrings and my quads, and I would be doing an agonist-antagonist pattern. This pattern is just a reciprocal right, left, and we're focusing on the quads, on the lower extremity as a driver of patterning, of, you know, giving that background input to the central nervous system. On the upper extremity, we can target the triceps. Coincidentally and nicely, most of our patients, if you wanted to pick a muscle group in the upper extremity that they have problems with, triceps is one of them. If you want to pick a muscle group that a lot of our patients have trouble with in the lower extremity, the quadriceps is a key muscle group. So I have myself set up. I'm going to have the portable unit. I forgot to point out, or I didn't think about pointing out at the time, but as you know, we have the color-coded ends as well. And there's a small, very hard to see red and black little rubber band around the ends that would indicate that the red obviously is the positive electrode and the black is the negative electrode. So when you're attaching your electrodes, you want to make sure that you're putting the negative electrode where your negative placement is and positive where your positive placement is. So I'm going to go ahead and just connect these electrodes. I will say that I used good skin prep prior to setting these up. I used water. I wanted to make sure I hydrated my skin, cleaned off my skin, any dirt, any debris. That will not only help my electrodes stick, it will help my electrodes last longer, and it will also increase the comfort level of the electrical stimulation. Okay, so I'm going to go ahead and set it up, and it doesn't really matter if channel A is on the right or the left. It really makes no difference, but I'm definitely going to have this set up, and I'm paying attention to that black and red, as I mentioned. Just a little quick discussion. about electrode size. You'll notice I'm using 2x4 electrodes. We always want to try to go with the larger size electrodes that we can fit in the space without getting too close together. So I clearly have a nice spread between my positive and negative electrode. If you're doing an arm and it's a really tiny person, there is a potential you might choose to use the 2x2 electrodes. Just remember, that the smaller the electrode, the more current density we have at that point. Okay, so I've got it set up. I'm going to have this person possibly doing some standing. I'm going to be showing you some stuff. So another thing to consider is I put my little lead wire from my electrode kind of coming from the bottom of my electrode. And I did that so that when I do get up into a standing position, gravity is not trying to pull that electrode back. If I had it in the opposite direction, sometimes the weights, or you can kind of get some pulling down. And that's especially true with the heavier lead wires that we'll see on our traditional OmniStim unit. Okay, so I'm all set up. I'm going to power the unit on, as I showed you earlier. I'm going to leave my parameters where they were. I think I lost the camera. Oh, there we go. Everybody see what I'm doing here? Hopefully. I'm going to just start taking my intensity up. Now you can go up one channel at a time. So right now I'm just going up on my green channel, which happens to be on my left lower extremity. And what I'm feeling is a buzzing sensation, kind of on, and then it's off, and then it's on, and then it's off. And I'm just going to keep going up until I get the desired contraction, which we really want to be a visible muscle contraction that the patient will be working with when we're doing our activity. So I'm starting to, you can kind of see what I'm getting there. I'm actually getting a little bit of knee flexion. Let me see if I can show it better. Okay, that's hopefully visible. If it's not, I can go a little higher. There we go. Can you see that nicely? And then I'm going to do the same thing over here on my right leg. So I'm just pressing my button up. It's going up in increments of one at a time. And eventually I will get to the point where my right leg is doing what my left leg is doing. And we're going to be working sort of in that rhythm, that nice pattern of reciprocal movement. So what you can see now, hopefully nicely, is that I've got this rhythm. 1, 2, 1. Everybody see that?
Debbie, the visual is perfect.
Okay, wonderful. So let's talk about what kinds of patients this might be helpful for while we're thinking here. I'm sitting. I could have been potentially set up with these electrodes, and I could be, if I'm very weak and I don't have a lot of tolerance for sitting, part of this treatment time, I could be laying down and encouraging that patient to do some terminal knee extensions, kicking their legs out. I could move that patient to the bedside, sitting on the side of the bed and have their legs dangling, sort of like I'm in the position right now. And I could have this running, and the idea being that the patient is going to be actively engaging those quadricep muscles and generally sort of falls into the pattern that we're applying. Maybe I want to have that patient stand up. And at this point, I could be working on some back and forth stepping. Now, I did not change the RPM on this. So this was at the default RPM. And I will tell you, it's a little bit fast for somebody who's maybe a little low level. Okay, this is about the pace that I'm going. A little bit faster. So if this was a patient who doesn't have a lot of endurance, or maybe there's a little bit of delay, I would pre-select a lower RPM. But if I wanted to work on a patient and I wanted to encourage them to get a little bit more vigorous and a little bit more activation, maybe I have them on the cycle program, and this is going to match really nicely on the OmniCycle as I push through those RPMs. So I'm going to be using my legs at the same pace that I'm being cued, in a sense, to continue. So this is an example right here of sort of that default RPM setting. All right, so let me show you. I'm going to stop it for a second, shut it off. I'm going to turn it back on, and I'm going to tell you right now, I can check and see what that RPM was to give you a good idea. That was at a 40 RPM pace. All right, I'm going to slow that down, and I'm going to go all the way down So I do a slower RPM just to give you an idea how this looks to 10. So that will only be 10 times in a minute that you'll see this cycle through. And then I'm going to go ahead and take, oops, sorry. I have that set. I'm going to go ahead and take this back up. And I am pressing both buttons at this point because I already know that I was, in a higher level and I want to save time. So I'm just going to take this up until I get my desired result, and then I'll fine tune it by pressing one button at a time. Okay. So you can see I'm actually getting a pretty strong contraction on that one side, but you can see I'm holding it longer and it's a much slower pace. So I'm going to be instructing my patient, kick, 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 kick the right leg. Now to the left, here it comes, left, 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 left. And they are getting a really nice tactile stimulation as well as active assisted contraction because they're volitionally working at the same time that the e-stim is running. So if I were to have that person in standing at this point, this is kind of at the pace. I'm standing and then I'm standing and I'm switching and I'm switching. And you can even see it kind of helping me get that terminal knee extension, giving that active assisted stimulation. Maybe they only do this for 30 seconds and a minute because they're so weak. They need to take a break. You're going to have them sit back down again. And then while they're recovering from that cardiovascular challenge that they have with their body weight, they're still getting some really great input neurologically and getting some extra repetition. And then after a rest break of 2 or 3 minutes, again, back up again. And let's work on that. Let's try to see how long we can work on this back and forth. So that's just an example of a way to clinically fit this into your practice. I think it's a great way to really get these big muscles, these big important muscles active. And because it's so portable, it's such an easy way to take it with you up to the floor, into a patient's room. Maybe we're not able to get them in the parallel bars because I can't bring them down to the gym potentially. I can do this with a walker and I can be standing right in front of them. And here I am getting some great facilitation while my arms are busy, maybe facilitating their trunk or actually helping them do a mid assist or even a mod assist standing weight shift right in front of the bed, because I'm not going to be taking this patient walking at this point because I might not be able to do that safely. So we might be doing a lot of pre-gait until we can get back to our equipment in the gym. That's sort of a COVID scenario we're running into a lot. But I think even after we get past COVID, after we get past the issues, I would love to see this incorporated a little bit more with our cycle and our walking and pre-gait, because I do think it has a lot of great value. Since I'm on the message of COVID, I wanted to remind everybody on infection control. So clearly this would be brought into the patient's room with the electrodes. The electrodes would be taken off, put back into their package, and not removed from the patient's room would be my suggestion if they were actively a patient that's on isolation. And then we also want to make sure that we're disinfecting our unit when we're finished. So we want to make sure we're using the appropriate disinfectant. We use super sandy wipes, whatever you have in your facility that's an approved disinfectant. We also have, for our diathermy head covers, we are using basic generic shower caps. So I didn't have one, but I had this epiphany that this is such a nice way and such an easy way to add just a second layer, a barrier, where I can actually have my unit sort of still accessible button-wise. I can still see nicely, but I'm giving a little bit of extra infection control. And when I'm finished with that patient, this goes in the trash in their room and I wipe everything down with my super sandy wipes. And that's just another alternative way of using an infection control barrier kind of creatively. So a shower cap if you got it. If you don't, these are those old-fashioned style of sandwich bags that you should be able to possibly incorporate. Okay, so that is the cycle walk, some ideas. If I'm working on upper extremity tricep strength, I can certainly have that patient be doing some pushing rhythm in the room, using maybe TheraBand at this nice slow pace if I wanted to. You can also incorporate that if you don't have access to the OmniCycle, if the patient is unable to come down to the gym. Clearly, we can use it on an OmniCycle or any other reciprocal exercise unit. Okay, so that's sort of the concept. That's the idea. I showed you a faster pace. This is the slower pace. Obviously, on the slower pace, you can see that the contraction lasts a little bit longer. So we're actually getting into kind of that active assisted, which is nice again when you have a patient that might have a little bit of that delay, you know, oh, I feel it, okay, kick your leg. You know, it takes them a second or two to actually engage their own muscles in response to the neurostimulation. Okay, so what we're gonna do now, turn that off. I would then disconnect my wires. So I'm gonna go ahead and do that. And then I wanna show you, it's gonna take a second to kind of change my camera angle, but I want to do want to show you how to find this protocol on the OmniVersa so that you can use the cycle walk with that unit as well. Somebody might have the portable, you could take the other unit. Now 2 patients are receiving the benefit of the program. So portable, done for the moment. Okay. So Kelly, can we switch back to the camera mode? See what I got here. Terrible. Hopefully you guys can see that. I'm going to turn it on. So this is the OmniVersa. And I just want to sort of review how to find this program on the OmniVersa and some of the resources that you have with this. What we're going to see is we're going to see that we certainly have the screen that comes on at first. Obviously, this is an electrotherapy option, so we're going to press electrotherapy. And as you know, as most of us in ACP, we talk a lot about using the indications menu because indications menu is going to give you some cues and some pictures and some guidance as far as what is the physiological reason I'm using eStim. So we're going to hit indications. And then the first page of indications, you can see we have 3. The first page is our traditional NeuroRead, which is our triphasic programming or biphasic programming. Some of our pain programs, that's all first page. We're going to turn the dial until we see the second page, and then you're going to see we have functional READ. So if I were to choose functional READ upper extremity, you're going to see the PENS cycle. I'm going to back up the screen, and if I chose functional READ lower extremity, you're going to see I have the PENS cycle, but I also have that PENS walk to run that I mentioned before. So let's talk a little bit about the buttons here. Anytime in indications you see these little information buttons, if you press that, what it's going to do is it's going to give you a page or 2 of brief description of the goals of this program and some of the parameters that can be modified. If you turn the page, continues with that narrative, and then we're going to actually get into a location where we see someplace pictures. So here you can see, that just reminds me, oh, okay, that's how I want to have this set up. Bilateral lower extremities. Okay, so you can see we've got the negative on the VMO area and the positive. I'm going to back up one more time because I do want to show you how on the upper extremity under PENS cycle, we have similar descriptions. We're going to roll through, and then there, of course, they give you the example of the triceps. For reciprocal elbow extension. And then they also show you that this can be done on the shoulder extensors. So if you're working on somebody for wheelchair propulsion, you know, maybe you feel like the shoulder is worse than the triceps. Okay, well, we'll change our placement and we'll end up using that as a potential option. So you have a couple of different placement options for the upper extremity. Back again, we're going to go back again to, well, this is fine. We'll stay with cycle. And then you'll see here the 70 microseconds. So remember, the portable is defaulting to 100. This one is defaulting to 70. Very easy to change that if you would like to. You just highlight it and turn the dial. This is the RPM. What I'd like to show you is that obviously I can change the RPM prior to starting, and I'm going to go down all the way to 10. and I can take this all the way up to 120. That's really fast. So, you know, you may not get there, but just so you know, you have a little bit more of a swing on the RPM on the Versa, then you can't go up quite as high as that on the portable. So I'm going to turn this down. The other nice thing to know is that I'm turning my intensity up. You can do channel A by itself, channel B by itself, or both until I get the desired twitch level. I hit start. It's going to start that rhythmic back and forth, right, left, right, left. And then with this program, I could say, you know what, I decided 82 is too fast. I'm going to lower it. I'm going to lower it down to 60. It will let you change that while you're actually in the program on the Versa. Remember, on the portable, you have to decide what RPM you want prior to starting the program. Now, if you determine it's not the right program, you just stop it, change it, restart it. It's pretty quick. But just wanted to let you know that you can't change it on the fly within the program. Once you hit start, you can on the Versa, you cannot on the portable. Okay, so that's where you find those programs on the OmniVersa. The portable unit, now you know what it looks like, now you know where to find it, now you know how easy it is to use. Hopefully you can start incorporating this as needed. Remember, we have a lot of weakness and functional problems related to weakness. So we really, really, really want to kind of give them any extra we can. And I love the way we can use pens and we can do functional things while it's running. And then when they take a rest break, we're still giving them a lot of great input neurologically via the eStim. So it's a really great way of kind of adding more intensity to your therapy sessions, even when that patient might have limitations in their endurance. It's a really great add. And I think I've covered everything I had planned to cover. So if any questions, and Kelly has anything for me to follow up on, I'd be more than happy to answer those.
Thank you, Deb. There's no open questions. Thank you so much for the thorough overview of the cycle walk, as well as how to find it on the Versa. The practical application is fantastic. With that, I'm going to close this webinar. Thank you for those that attended today.